our viewer writes, there are so many different types of breast implants, from saline to silicone, now gummy bear and teardrop. I didn't even know that. Can you tell us once and for all which one you would recommend?
Well, I don't think it's cookbook surgery, and you have to do surgery and use an implant that's depending on the tissue elasticity, the size of the person's chest cavity, and I'm not a fan of the teardrop-shaped implants because I think they can rotate, but they're great in some cases.
This is a teardrop shape, and what Dr. Fisher is saying, that there is a top and a bottom.
Oh, wow.
But if you do, and you can get this, that movement inside the body, if you have a big pocket, it can rotate.
I'd prefer to have one partially underneath the muscle, so wherever it rotates, it's always teardrop.
What's the gummy bear?
Yeah, what's the gummy bear?
The gummy bear is just an implant that's more of a solid than a liquid, and if you cut through it, it'd be like a pie. It's a form-stable implant, and those are the ones that they generally use for those type of procedures.
The design of the implants now, the outer shell is much more durable. The filling is more cohesive. What does that mean? Well, they're not going to rupture, less likely to get firm, less likely to show ripples. All of those problems that we saw in the past, we're seeing less and less of that. And we have choices where we place the implant. Below the muscle, below the fascia, partial, we all have options. Everybody's a little bit different, so there's not one cookbook breast surgery for every patient.
I agree.
Do you feel like the trend has come down, like compared to the 80s and 90s when people were bigger is better, that now people are looking for smaller, more natural implants?
I think the plastic surgery IQ has been raised significantly in the patient population where they know what they want, what they don't want, and I think what they really want is a natural result, whether it's big or small, but I do believe that you do see smaller implants now than we used to see, and there's problems associated with that, but the larger implants are generally in Los Angeles, Miami, Dallas, and then
exactly. It's funny when we go to our national meetings and we have panels like this. What's your average implant? And the highest cities are going to be Los Angeles, Miami, Dallas, New York, and Boston shrink.
Right. Brazil's still up there.
Oh yeah. But what we're seeing a lot of are some of these patients that we did 20 years ago in our practice that they were young. We put big implants in. Now as they age, lose skin, may have had kids. So now they want to come in and downsize, and that's where the whole thing, I think the biggest trend now is downsizing with a lift. And our ability to do a good lift now is better than ever.
Much better.
Well, gentlemen, this was wonderful. Dr. Diamond, Dr. Fisher, thanks so much.